Good day, everyone. I am Obonna Ebuka Prince from Nigeria with my colleague, my Affirmative Team partner, Nasanga Shadai Kampala from Uganda. Our topic for this debate session is: should African government adopt policies mandating genetic counseling for high-risk individuals diagnosed with breast cancer? So we will be saying thank you to PAPERI for giving us this privilege to pour out our minds on the need for genetic counseling in Africa. So for the sake of those diagnosed with breast cancer and other related diseases too. So we would like you to follow us and stay focused. So on this introduction, we stand today to affirm the motion that African government should adopt policies mandating genetic counseling for high-risk individuals diagnosed with breast cancer. Breast cancer remains one of the leading causes of cancer-related death among women across Africa. Unfortunately, patients are diagnosed at advanced stages, and at a significant proportion of those classified as high risk carry inherited genetic mutations such as BRCA1, BRCA2, and the TP53 and others. These mutations are not only they don't only influence the patient's treatment options, but also they determine the risk faced by their children, siblings, and other close relatives. So genetic counseling is a specialized healthcare service where trained professionals help patients understand inherited cancer risks, interpret genetic results, make informed treatment decisions, and communicate these risks appropriately to family members. So it must be informed decisions, because everybody's disorder is at personalized level. So there must be a precision technique for every person. So we can't just fade that away, saying that we don't need them, having known that this is at individual level, precision level. So every hand must be on deck to make sure that every individual has these tailored pre-informed decisions for futuristic healthcare procedures. So we go over to our opening statements. When we say government should mandate genetic counseling, we are advocating for a policy that ensures every high-risk patient receives professional counseling as part of standard cancer care. It is not to punish or discriminate against anyone, but to guarantee that no patient makes any life-changing medical decisions without adequate genetic information. We hear our opponents repeatedly confuse mandatory counseling with mandatory testing. These are entirely different concepts. Yes, because even counseling merely guarantees that every eligible patient receives professional information before making life-changing medical decisions. No one's DNA is taken without consent. No treatment is forced on anyone. What is mandatory here is access to knowledge. If governments can mandate counseling before organ transplantation, certain surgeries would not be relevant again. Then requiring counseling before hereditary cancer decisions is equally justified. Ignorance is never better than informed choice. Yeah, and we hear this cliche: prevention is better than cure. Therefore, we firmly support this motion because it promotes informed healthcare decisions, reduces preventable cancers in families, and strengthens public health systems, and ultimately it saves lives. So our constructive arguments are taken as follows. Argument 1: it improves patient care and treatment outcomes. Breast cancer is not just one disease. Patients with inherited mutations often require different treatment approaches. Yes, So for example, like this BRCA mutation gene, carriers may benefit from PARP inhibitors. Some patients may even require bilateral mastectomy rather than treating only one breast cancer only one breast. So genetic information guides chemotherapy choices and other surgical decisions too, which without counseling, all these may prove falsified. So constructive argument too, here it protects entire families, not just one patient. High risk breast cancer is often hereditary. Yes, one patient diagnosis may reveal risks affecting sisters, daughters, families. When counseling is mandatory, family members can undergo screening earlier, have early detection and early survival, cheaper treatments, and all that. One counseling session can potentially save multiple generations. So we don't know why we should say no to mandating of these genetic counselors in Africa, since there are lives that will be potentially saved. Also, it reduces long-term healthcare costs. Opponents may argue counseling costs money, but treating advanced cancer costs far more. Yes, because government already spend enormous amount treating metastatic cancers. Early genetic counseling leads to earlier diagnosis, preventive screening, preventive surgeries, reduced hospitalization, and preventing one advanced cancer case that can save thousands of dollars. Thus, genetic counseling we can save from here. It is very much economically wise. So also we can also say that it promotes equity in healthcare today in Africa. Yes, because only wealthy patients, it looks like they are the only ones who can access genetic counselors. Most rural patients never hear about hereditary cancer. Government policies removes this inequality. When this kind of policy is mandated, you see the rich, poor, urban and rural areas who have high risk cancer, who have high risk patients everywhere, they receive equal access to genetic information and even education. Healthcare should not just depend on this income flow, or whether income flow or that. So we should propose altogether for the mandatory of genetic counselors in Africa. And also it supports precision medicine. Yes, it supports it in the sense that modern medicine shifting towards personalized treatment. Countries worldwide now integrate genetics into cancer management. Africa should not be left behind. Government policies will strengthen molecular diagnosis. It will strengthen, improve oncology services. It will strengthen, encourage local genomic research, build skilled healthcare professionals. This advances healthcare in Africa system. So also another reason for this mandatory is that it improves ethical responsibility. Yes, healthcare ethics emphasize beneficence. Yes, non-maleficence. It does not harm. It actually gives pre-informed consent. Without counseling, patients may unknowingly make irreversible treatment decisions. Counseling empowers informed consent. Governments have a moral obligation here to protect citizens through evidence-based healthcare policies. Okay, on our first rebuttal, ethical violation of autonomy and the illusion of choice. Our opponents argue that mandating genetic counseling infringes on individual autonomy. However, this argument misrepresents what the policy proposes. The motion does not require patients to undergo genetic testing or force anybody to accept any treatment. It only ensures that high-risk individuals receive professional counseling before making important medical decisions. Therefore, mandatory counseling strengthens patient autonomy rather than just undermining it. Rebuttal 2 is that critical infrastructure deficit and specialist shortages. The negators have argued that Africa lacks sufficient genetic counselors and infrastructure, making the policy unrealistic. While workforce shortages are a legitimate challenge, they are not a reason to reject a beneficial healthcare policies. Yes, because similar concerns were raised when HIV counseling, cancer screening, and vaccination programs were introduced, yet government expanded these services over time rather than abandoning genetic counseling because of current limitation. Adopting it would also help encourage African nations to build the capacity needed to provide equitable and modern cancer care. So thirdly, on this rebuttal, the arguments have been on severe resource allocation inversion and high opportunity cost. The negative team brought to light the status quo in sub-Saharan African countries, where patients are diagnosed at stage 3 to 4, which is not necessarily a good thing, and is exactly what we are trying to find a solution to. So that calls for mandatory genetic counseling as their health matters as part of the public. And finally, we draw attention to social cultural stigma, gender vulnerability, and psychological harm as the negators argue. Well, truly, absence of mandatory genetic counseling does not necessarily eradicate the disease, so the fear is always existing, the stigma from society, and these are things that need a solution. And exactly that's what we want to present to the public. So, honorable judges, today's debate is not just about government control, it is also about responsible healthcare. High-risk breast cancer affects more than one individual. It affects entire families, entire future, entire generations. Genetic counseling equips patients with knowledge, guides doctors towards better treatment, enables relatives to seek preventive care, reduces healthcare costs, and strengthens Africa's healthcare system irreversibly. So for these reasons, we respectfully urge everyone, the government, to support the motion that African governments should adopt policies mandating genetic counseling for high-risk individuals diagnosed with breast cancer. Thank you.